Okay, I have Michael Nowak, 32-year-old male. His date of birth is 11/24/93. He had a TBI from an MVA 3 weeks ago, was discharged. His wife just brought him back because he just wasn't acting quite right at home. He has been sleeping pretty well throughout the night. His assessment was all within normal limits with the exception of his neuro status. He is slightly agitated, but overall, he's been pretty pleasant all night. He does have allergies to sulfa drugs. He does have a 20 gauge in his right AC. It flushes easily. Dressing is dry and intact. Vitals are currently fine. Blood pressure is 138/84. Heart rate is 96. Respiratories are 18. His oxygen is 98% and his temperature is 98.6. He did get a CT and an MRI earlier this morning. I haven't seen those yet, and I also did pull labs. I don't have results back. So we got report. Now we're heading in to introduce ourselves and do an assessment. So the first part of our assessment is going to be to ask orientation type questions like what's your name, what's your birthday, where are you, do you know why you're here? While asking those questions, make mental notes on his facial symmetry, hearing, eye movements, and speech. This is assessing his cranial nerve function because remember, he did have the TBI 3 weeks ago. So as you're speaking with him, you're going to find that he's not fully oriented. He's a little bit confused, so you're going to do your best to reorient him in this situation. You should also notice that specifically when you're trying to check his pupils, he is going to get a little bit agitated. So moving through your head to toe, we're focusing on neuro aspects. So continuing to speak with him, making sure he can follow commands is a big thing. Checking those push, pulls, and grips shows us his motor function, and you'll find that it's functioning pretty well. So even though that this is obviously a neuro problem, we still want to do a full head to toe just to be on the safe side because we can't always trust a report that says everything is within normal limits. Another good assessment technique for like his coordination would be like a finger to nose type of deal. You don't see it in the video, but I thought I would mention it. And then also he did have that brain injury, so we don't want him up and moving, but that's also a good part of neuro assessment to see coordination. So we've completed an assessment. Now we need to be checking in on him, seeing if there are any urgent problems or complaints from him, which there is.
Pain for me?
8 probably.
Okay, alrighty. I'll go get you something. Okay,
Yeah,
I'll
something,
see what
something for it. It's bad.
I'll see what the doctor has ordered. Okay.
Okay.
So he's complaining of a headache. And now would be a great time to check the provider's orders in the MAR if you haven't already. So you'll see the only thing he has ordered is Tylenol, and he did rate his pain an 8 out of 10, but giving him an opioid would cause mental status change and decreased LOC. Yep. All right, Michael, I'm back with some Tylenol for you.
Up time.
Here's this. Perfect. Okay. So we need to be doing frequent neuro checks on him. We're looking for any slight changes. So here I'm just reassessing the headache and seeing if the Tylenol helped. We're going to see him become super agitated. He's going to try to pull out his IV. His tone and mood is going to be more aggressive towards us. And the goal is to try to de-escalate. And as you can see in the video, I'm just kind of explaining the same thing I'm explaining now, that we're going to try to de-escalate. We're going to try to reassess him, but he's going to be refusing and complaining and still very heavy on the aggression. And also right now, it's a great time for somebody to look back, or if they remember the provider's orders, notify the physician if the patient becomes agitated and unable to be de-escalated. So now it's time to call Dr. Cutler. We're going to give a quick SBAR just so he knows what's going on with Michael. And the biggest piece of information to give to Doc is the change from recently calm overnight to now agitated and unable to be calmed down. Now you should also be getting lab and imaging results back, so you should have been able to refresh your screen and see that. Okay, so here's our CT. There's no brain bleed. Here's our MRI. We have frontal lobe contusion with temporal bruising. This is why we have agitation. Here's labs. Coagulation studies are normal, supporting the CT impression. CBC is a little off in some places, but remember, he's healing from a TBI, so that's kind of expected. Your chemistry is super important because that sodium is getting really low. Sodium is 122, and that's a cause for concern, so this needs to be reported to the doctor. Over the phone, Dr. Cutler will give you verbal orders for seizure precautions, and he will get you some med orders too. So now you have orders for lorazepam. So you can see those blankets on the bed rails right there are your pads, because we need to put pads in the rails. Make sure those rails are up too. We're going to have that suction set up if it's not already set up. He is actively seizing in the video right now, so you can see us kind of doing all those things, calling for help. We are timing the seizure. We're not putting anything in his mouth. If we're able to safely turn him on his side, then we will do that, but we shouldn't put ourselves in harm's way to protect him. And then also we're going to draw up that lorazepam that we have orders for, and we're going to IV push. Push it over at least 2 minutes, so that's 2 milligrams per minute. There's no need to slam it. And the sim's over. The shout out to the textbooks.